And the CDC has removed tens of thousands of deaths linked to COVID-19, including nearly a quarter of the deaths of those under 18 years old. And while many health professionals are taking this as good news, they're also raising concerns about the reliability of the data. Here's more on that story.
The CDC quietly removed tens of thousands of COVID-19 linked deaths from its data tracker website on March 15th. Of those removed were 416 deaths among children, 24% of the total child death count previously listed on the CDC's website. The CDC cut an additional 71,000 virus deaths, bringing the total to just under 780,000. Kelly Cronert, a Georgia resident who runs a COVID data tracking website, documented the change in numbers. On the CDC's tracker website, the agency says data on deaths were adjusted after resolving a coding logic error. This resulted in decreased death counts across all demographic categories. The CDC relies on states and other localities to report COVID-19 deaths and acknowledges that the data is not complete. Yet the statistics are often cited by those advocating for vaccination against COVID-19, including by CDC Director Dr. Rochelle Walensky when she pushed for an expert panel to advise the CDC to recommend the vaccine for all 5 to 11-year-olds. In an email to the Epoch Times, Cronert said, "The update is an improvement, but it's at least the third correction to this data and still does not solve the issue. It just highlights that people have been using a flawed source of data when discussing kids and COVID." A number of medical professionals responded positively to the child death count being cut by almost a quarter, but raised concerns that the data is being used widely to guide and advocate for policy.